What we are going to talk about now are how we use lingual braces with Powerprox 6 Month Braces. Now, why would we even use lingual braces? There is quite simply one reason: aesthetics. Lingual braces are the only non-visible, fixed orthodontic system available. Take a look at this patient here. She is wearing full upper and lower lingual braces, but no one is going to know that she's wearing braces at all. Why? Because the braces are behind her teeth, so no one can see them. Completely invisible, completely aesthetic. This patient here, he is also wearing full upper and lower braces, but no one can see them because they are behind his teeth, so no one can see him. No one needs to know that he's straightening his teeth. Another case, no one will know this patient is wearing braces because the braces are behind her teeth, so no one can see them. Completely invisible, completely aesthetic. That is why we use lingual braces. Now, why would you combine the two, lingual braces with Powerprox 6 Month Braces? Combining these two overcome the two biggest patient objections to treatment, which are long treatment time and visibility of the braces. Also, they overcome a significant mental hurdle that the patient has to wearing braces. Patients do not view lingual braces behind the teeth as braces because you can't see them. Okay? So what will often happen is you will get a patient who will come in wanting lingual braces. Now, this patient would have never, ever come into your office had you been offering just labial outside braces. But many times, maybe this patient isn't a candidate for lingual braces, or maybe they don't want to pay the higher fee. A lot of these patients will ultimately say, well, you know what? 6 months of clear braces on the outside isn't so bad. But these are the same people that would have never come into your office, but you had a chance to get them into the office, get them excited about what you could do for them with Powerprox 6 Month Braces, and even if they decide not to go forward with lingual braces, many will often still do outside labial clear. Okay, it gets over that mental hurdle to get that patient into the office. So as such, this provides an enormous marketing advantage. Not a lot of offices offer lingual Powerprox 6 Month Braces, so you can really develop a micro niche in your office, get a lot of buzz around what's happening in your office, and get known in your area as the doctor who not only straightens teeth quickly, but also invisibly. That's what lingual Powerprox 6 Month Braces do. Now, obviously, there are going to be pros and cons for the doctors and the patients when using lingual braces to straighten teeth. For the doctor, again, it will allow the treatment of patients who absolutely refuse labial braces. And there's going to be some that I won't wear braces on the outside. So now you have another option you can give these patients. Also, it really lets you view what your final result's going to be, obviously, because there's no fixed hardware on the labial surface of the teeth. You get to see your final result before you remove the braces. Also, you can charge more for lingual braces. It is amazing what these patients will pay. When they want fast and invisible, the sky's the limit. These patients want something. They find a way to pay for it, even at higher fees. We charge roughly double for lingual braces compared to labial braces, and patients still happily pay that fee. When they want invisible along with fast, it is amazing what these patients will pay to get that done. And also, again, many patients will come on in saying, I'm only getting lingual braces, but maybe they decide they can't afford it because it is a higher fee. And now we often hear, I can't tell you how many times we hear, well, 6 months with clear braces on the outside of my teeth isn't so bad. But again, these patients never would have come into your office had you not had the ability to perform and offer lingual Powerprox 6 Month Braces. Now, certain movements are easier with lingual braces. Very easy to protrude teeth, expand teeth, and very easy to open bites because they have a built-in bite plane that acts exactly like our composite buildups do when we're doing labial braces. So we get all the same benefits. We can open deep bites, allow for immediate lower arch bracketing, and the teeth can move more quickly because we're not constantly fighting the forces of occlusion. Same exact benefits, whether it be from a composite buildup on the anterior teeth or from the lingual bite plane that's built into the lingual brackets themselves. Disadvantages for the doctor. Obviously, access is going to be more difficult because the braces are on, the inside, the lingual side of the teeth. A little bit more difficult to ligate initially. There's a very short learning curve for ligations. It really is not that difficult. Tying in your first arch wire for your first handful of cases may be more difficult just because you haven't been used to working on the inside of the arch as opposed to on the labial surface of the arch. But really, it's a very, very, very short learning curve for doing arch wire ligations with lingual braces. A bit longer chair time, particularly initially, we're talking maybe an hour for total treatment time, not an hour for appointment. But if it takes you maybe 2 to 3 hours of chair time for a labial case, maybe it's going to take you 3 or 4 hours for a lingual case. Specialized instruments, the only specialized instrument you want to have is a curved Mathau plier. It's just so much easier to ligate on the lingual side, your O-rings and power chains, with a curved lingual Mathau. Everything else, wine guards, distal end cutters, pin and ligature cutters, you name it, every other instrument, I use the same ones for labial and lingual. Now, you do have to have some indirect bonding skills. Lingual braces need to be bonded indirectly for a couple of reasons. One, the access is just so much easier because you're working on the opposite side. And two, all lingual braces are customized for each individual patient. So they do need to be indirectly bonded. Also, we do have a shorter inner bracket distance. Okay, the arc on the inside lingual is smaller than the arc on the outside labial surface. So the space between the brackets where you have wire helping you work is smaller. So we do have to use more rotation tricks in lingual. We do a lot of power chains to rotate and rotation ties as well. I like to have my patients on that first month, I like to use those extra comfort aids. We use bumper tubes on areas of exposed wire, and I like to do my initial tie-in on the posterior teeth with separators as opposed to O-ring elastic. The separators are bigger and more cushioned, and it allows for a very comfortable start to treatment. I also like to use blockout resins or even flowable composite right on the terminal part of the end wires where they're coming out of the molar tubes in lingual, because any extra wire on the labial, it's not going to really bother their cheeks too much, but on the lingual, every time they swallow or move their tongue, they may nick the side of their tongue. So I like to have some blockout resins placed initially. Now, with lingual braces, it is more difficult to use elastics. So if you're needing to use posterior box elastics, anterior elastics, it's a bit more difficult. But we'll show you how we do that. Again, shorter inner bracket distance, as you can see in this diagram. We have a longer inner bracket distance on the labial versus the lingual. That means we have less mechanical advantage on the lingual side, so we do have to use a few more tricks, such as power chains to rotate and rotation ties. Advantages for the patient, obviously, they're extremely aesthetic. No one needs to know that they're wearing braces or straightening their teeth because there's no fixed hardware on the labial surface of the teeth. No brackets are showing. Additionally, the labial surface of the teeth is not etched, so you're not going to have issues with decalcification or anything of that nature. And also, if they happen to be, active in sports, if they catch a ball to the face, you're not going to be peeling the lip off of labial brackets. We've all, I'm sure, had that situation, unfortunately. If it hits them in the face and they have lingual braces, it's going to protect their lips in case of that impact or that trauma. Now, the patient's tongue will be sore. What I tell the patients is this. You're going to be sore for the first 2 weeks, no matter what type of braces you pick. If you pick outside braces, your lips and cheeks are going to be sore. If you pick inside braces, your tongue is going to get sore. And the teeth are going to be sore for the first couple weeks, or 1 or 2 weeks, no matter what. It's not going to be anything that's going to drive you crazy. Advil, Tylenol, whatever you take for your headache's going to work. But one side's going to be sore. Just pick which side you want to be sore, your lips or your tongue. Okay? Now, initially, the patient's speech will often be altered with lingual braces. What I tell each patient to do is I tell them, once we put your braces on, I want you to go home and I want you to, read out loud a book, a magazine, whatever, and practice talking for, a half hour, however long it takes till they start to talk more normally. And everyone has done very well. In fact, Margie's actual training is in speech pathology. She used to work down at the Cleveland Clinic on the rehab unit. Her area of expertise was swallowing disorders. One of the things we were going to have her do when she came to work for me was to do myofunctional therapy on open bite cases, and also some speech therapy on our lingual braces patients. Well, it turns out tongue beads work so well, we didn't need her for the myofunctional therapy, and the lingual patients talk so well, we didn't need her for the speech therapy. So the patients do very, very, very well. Now, it is a little bit more difficult for the patients to clean the lingual, but I actually think this is more due to the visualization. You can see the labial braces, and you can look in the mirror and see, hey, have I cleaned my teeth well? Whereas with lingual, they don't see it. They're more likely to ignore it. So I really tell the patients, make sure to really get in between the bracket and the gingival tissue when you're brushing with lingual braces. More difficult to eat? Not really. It's no different than a patient who's wearing buildups on a labial case. It's just because they have that bite plane anteriorly, which again is analogous to composite buildups. They do very, very, very well. Now, they do cost more. Okay, lingual braces do cost more. There's a lab fee involved, and it's going to take you that little bit extra, maybe 1 hour or so of extra chair time to do these, and obviously a little bit more training, which is why you're watching this video. Okay, but remember, patients will pay more for what they want. When they want fast treatment and they want invisible treatment, Lingual Powerprox 6 Month Braces, that's the ticket.